Welcome everyone to today's webinar focused on aligning the field around our 988 messaging framework. We're delighted to have all of you. My name is Kim Torgerson and I am the Director of Communications and Engagement for the National Action Alliance for Suicide Prevention, housed at the Education Development Center. And as many of you might know, the Action Alliance is the nation's public-private partnership for suicide prevention, working alongside diverse sectors to really help to implement the national strategy for suicide prevention, which we like to say is the nation's roadmap for addressing this leading public health issue. So that's a little bit about me. And I'd like to introduce our panelists for today. And before I do that, critical to the success of aligning our 988 messaging is all of you. We thank you for joining again. 988 is too big for one group alone, and it requires collaboration and alignment. And we want to hear from you today. So we encourage you to please chime into today's discussion using the Q&A function, which you'll see on your screen. Next. We are delighted to be joined on today's webinar by some leading partners, especially given their leadership in the development of the 988 messaging framework. We have leaders including Rheingold, who is a leader in messaging, SAMHSA, the federal lead of 988, and Vibrant Emotional Health, as many of you know, is the home of the National Suicide Prevention Lifeline. Next. I'd also like to thank both the 988 messaging framework, who helped to guide the development of the framework, as well as Action Alliance's executive committee member, Johnson & Johnson Jansen, who provided support for the development of the framework. Finally, and probably equally important, I'd like to thank each of you for joining us on today's webinar. As you'll hear throughout the presentation today, you all have a key role to play in ensuring our messaging is aligned, is strategic, and effective. Again, we've carved out some time at the end of today's webinar to answer questions. So again, please do use that Q&A function that you'll see on your screen. And while we may not get to all of the questions, we will certainly share questions that we receive with our panelists, as well as identify the best way to get those answers out to all of you, the field. Next. Now, I'd like to introduce you to two senior leaders, one from SAMHSA and one from Vibrant, who are serving as national leads for the rollout and implementation of 988. First, Dr. John Palmieri currently serves as the acting director of 988 and Behavioral Health Crisis Team for SAMHSA within the Office of the Assistant Secretary. In this role, he provides subject matter expertise and policy leadership in areas that include crisis response, suicide prevention and interventions, care integration, and criminal justice diversions program. We also have Dr. John Draper, who serves as the executive director of the National Suicide Prevention Lifeline and executive vice president for the national network at Vibrant Emotional Health. In this role, John oversees all aspects of the SAMHSA-funded National Suicide Prevention Lifeline service and its partnership with the VA in administering Veterans Crisis Line. In addition, he is responsible for overseeing the Lifeline transition to 988, both of whom have big jobs, and we're very happy that they're here today. So let me turn it over to Dr. Palmieri so we can get started.
Thank you, Kim, and thank you so much to the Action Alliance and Vibrant Emotional Health and a host of other partners at the national, state, local level for making this webinar possible and for the opportunity to speak briefly on behalf of the 988 team at SAMHSA. So I'm John Palmieri, as Kim said. I'm the acting lead for the 988 and crisis team in the Office of the Assistant Secretary at SAMHSA. And I'm starting here with a slide that many of you have likely seen before, but I wanted to put our messaging planning in the broader context of two critical goals: strengthening and expanding the lifeline and transforming the broader crisis care system. We have said this many times in many briefings and conversations that we've had with our partners, but we truly believe that we are in a unique moment and a unique opportunity for serving individuals with mental health and substance use needs, and really see 988 as a catalyst for transformative change. On this slide, we've highlighted Pillar 3 as the focus of our remarks today, and we fully expect that messaging will evolve over time as we work toward these two overarching critical goals. In the near term, it is critical that SAMHSA work with its partners on aligned, coordinated messaging efforts, recognizing that the July transition is really just an initial step to a longer-term vision. Next slide, please. So in just looking for a moment to layer down at some of the strategic objectives that sit underneath these pillars of activity, and particularly focused on number 3, related to messaging and public awareness, we can see that the first 2 elements here really do speak to those near-term priorities around partnership and purposeful coordinated communication. SAMHSA is working closely with Vibrant Emotional Health and other state, national, local partners to ensure a successful transition. And consistent with our phased approach, it is important that our messaging does not get out in front of the system's readiness to take on what we expect will be increased volume with the transition to 988. We recognize that not everyone has access to 988 right at this moment, and we want to make sure that there are both people to respond and system functionality that's widely available before promoting the 3-digit number on a large scale. However, we really do see a need for general education and awareness among the field and to support key implementation partners. And that messaging can be taking place right now. And this is where the 988 messaging framework comes in that we're going to speak to today. Next slide, please. This slide, again, is perhaps familiar to many of you and really is intended to summarize some of the recent activities at the federal level with respect to shoring up those 988 operations to support the transition expected in July. Here we include references to reports that we've submitted to Congress, along with activities that we've been engaged in supporting appropriations in fiscal year 22. In our appropriations report, as one example, we have called out the importance of messaging and public awareness as we transition to 988 and beyond, particularly with respect to populations at higher risk of suicide and/or populations who have been burdened with inequitable access to care. And we are hopeful, based upon the proposed president's budget in FY23, that there will be additional opportunities in the coming year to build upon this foundation and this momentum as we accelerate toward July and beyond. Next slide, please. We are also leaning into multi-sector partnerships to align on the vision, to advance readiness, and to coordinate our messaging and our measures of success and progress. And clearly, we cannot do this alone. The slide notes just a few of the partners who have been working alongside us at SAMHSA to prepare for the transition to 988. As one example of this partnership, we are holding a series of convenings to support ongoing engagement, share views on readiness, and disseminate guidance and tools to advance implementation. We know that there will be a need for ongoing learning and ongoing system improvement, and appreciate the expertise and commitment of the diverse partners driving this work. I'm going to end my remarks here, look forward to the question and discussion phase later in the talk, but for now I'm going to turn it over to my colleague, Dr. John Draper at Vibrant, to share his remarks.
Thank you, John. Appreciate it. And thank you, Kim. And thanks to all of you for joining us today for this really important opportunity to collaborate in getting the word out about the biggest thing to happen in mental health, and certainly in my lifetime. And speaking of which, Yogi Berra probably got deja vu all over again every time somebody quoted him as saying he had deja vu all over again. But this really does remind me of when we launched the Lifeline back in 2005. We had a new name, a new number, and we needed to communicate the Lifeline to every stakeholder in the field. We had to get all of our centers to put the Lifeline on their websites, identify themselves as a Lifeline member. And we also worked with a marketing firm to develop Lifeline messaging toolkits, talking points, promotional materials, the whole thing. But of course, a big difference back then was that our centers weren't necessarily wild about advertising to their stakeholders, that they were answering Lifeline calls because they weren't getting paid to answer those calls. They had a local number that they've been answering and advertising for years in just about every case. And in every case, those funders who were funding them to answer those calls had established that line and wanted them to talk about that line. So advertising the Lifeline was a lot more complicated back then, at least compared to now, because now there is no need to keep being a Lifeline center a secret. Center funders now know that their center's a Lifeline member, and more than ever, they're funding them to answer Lifeline calls. And nothing has changed the way public health authorities view our centers more than 988. In many cases, they're eager to join with our centers in promoting 988 as the number to call for people in suicide and mental health crisis nationally. In a number of cases, a lot of the local funders are saying this 988 number is the number we're going to use locally rather than our 10-digit number. So they can use and build on our marketing campaigns, saving them time and money that they might otherwise invest that they could otherwise invest in services now. So we have more stakeholders than ever ready, willing, and able to promote this number. This is the right time to give them the right message for promoting the Lifeline and its number. They're lined up, so giving them the right messaging will go farther than ever in aligning our message about the Lifeline and its new number 988. Another thing that I think is also different from 2005 is the Lifeline is a lot better known. I mean, it appears on websites across the country. It appears alongside nearly every print and broadcast media mention of suicide. You can see it on signs and bridges, train tracks. It pops up when suicide appears in social media posts and browser searches. So will it now be just as simple as just adding 988 to these public health messages or replacing the 10-digit number they have listed there with this new 3-digit number? It may be. I mean, the media has basically been lined up as well. Giving them the right message now will go further than ever in aligning our message about Lifeline and its new number 988. There's also a couple of other things that I'm really excited about too. That in terms of embracing new stakeholders and getting the word out in different ways. So, for example, persons with lived experience from historically marginalized communities, many at the highest risk of suicide, and organizations that are designed to help us reach them, are becoming activated and interested in ways that we haven't seen before. And we can work with them to develop culturally effective communications approaches and work with them over time to develop such acculturated campaigns that people who would never have called otherwise, who might not have ever trusted the service, believe that the service is now for them, and we can make it for them by working with them. The other really exciting thing about aligning our messaging around 988 is that we can use 988 as a platform for messaging that can itself be an intervention for preventing mental health and suicidal crises. So not just promoting the number, but there is evidence that shows that providing the number along with stories of hope and recovery, the Papageno effect, stories about how people are positively coping through mental health and suicidal crises, there's evidence that shows that that kind of messaging itself reduces suicide. So you not only can put the number out there, but a number next to the story. So you get not only the helping effect, but the immediately hoping and hopeful effect. So because we've aligned our stakeholders in the media with our friends, the various national advocacy organizations, the people on this call, all of you, we can now build on this messaging in an aligned way because we're not starting from scratch anymore. Just like 988 is building on a network that has effectively been reducing emotional distress and suicidality, we're building on a Lifeline service that has been successfully promoted for years. However, we've never had more stakeholders engaged and lined up than we have now. So it's time to take mental health and suicide prevention messaging to a new level with 988. And we're delighted that we have all of you here to help us raise that bar, to help 988 become the amazing public health service that it's destined to be. All right, back to you, Kim.
Great. Thanks so much, John. And John, as you both emphasized so eloquently in your remarks, it is so important that our field is aligned and coordinated when it comes to 988 generally, but specifically messaging, which is why we're here today. The more consistent we are with our messaging, the more we will ensure public clarity, avoid confusion, and what John Draper said really also helped to spur greater hope and excitement amongst the field. And in fact, research does show that consistent messaging does have greater success when repeated by many across multiple channels, across multiple people. Next. So I'd now like to give just a high-level overview around how and why the 988 framework was developed, and particularly why the Action Alliance played a role in leading it. Next. Priority one of the Action Alliance's mental health and suicide prevention national response to COVID-19 was to change the national conversation about mental health and suicide with a specific call to action around coordinating messaging efforts in the context of 988. And through the national response, a group of public and private sector partners came together in early 2021. Some of those partners are on today's call, and identified an immediate and pressing need to ensure 988 messaging is coordinated and aligned. And it was those conversations that really helped to identify a solution. And that was the development of a well-informed 988 messaging framework to help ensure consistency and coordinated and accurate messaging. And as mentioned earlier, the Action Alliance's executive committee member, Johnson & Johnson, really recognized the need for this and helped to provide support to really make the 988 messaging framework a reality. Next. So the 988 messaging framework, it's intended to serve as a general guidance around when and how to message about 988 to ensure the messages are coordinated. It's informed by messaging best practices, such as the Action Alliance's framework for successful messaging, which some of you might have been aware of, and was developed to complement larger efforts being led by SAMHSA and Vibrant as national leads for 988, which we'll talk about in just a bit. Next. The development of the framework was informed by a number of key elements, and I'm going to go over three. One was an environmental scan. Two, a 988 messaging survey to the field, which many of you on today's webinar completed, and we thank you for that. And three, a 988 messaging task force comprised of a diverse group of leaders representing various populations and sectors and geographical locations. And I just want to provide a little bit more detail into these three elements. So again, you can really see that this was a well-informed resource. Next. So the initial step in developing the framework was to conduct an environmental scan of online news articles and messaging related resources and events about 988. And our scan was conducted between August of 2019 and November of 2021. And some key findings, which I think you'll all find to be really helpful and interesting. More than 170 news articles, this includes national dailies, community papers, et cetera, showed that one, a lack of consistent naming of 988. Some were calling it a suicide hotline, some a mental health crisis line. Two, the lack of specific coverage around high risk or disproportionately impacted communities. And next, these articles showed an increase in coverage around what's needed to ensure 988 is effective in terms of state level infrastructure needs. Next, again, when we looked at the scan at current public messaging resources, the resources showed an increase in 988 related resources focused on specific state level updates and challenges, a lack of information or resources, again, from high risk or minority focused organizations and agencies, limited resources walking through what will happen when someone calls, dials, or texts 988, and majority of the messaging related resources focused on 988 highlighted the benefits of having a mental health response to a mental health crisis versus, for example, a punitive response. Next. So following the environmental scan, in May of 2021, we wanted to better understand the current and anticipated needs from the field, all of you, when it comes to messaging about 988. So we developed and distributed an 18-question survey to hundreds of people within the field, again, many of whom are on today's webinar. And the survey received over 300 responses from individuals with diverse perspectives, including healthcare and treatment facilities, state agencies, crisis centers, suicide prevention and mental health organizations, private sector corporations and federal agencies, and tribal communities, and more. And of note, nearly 70% of respondents reported having lived experience, either as a suicide loss survivor, a suicide attempt survivor, someone living with suicidal ideation, someone living with a mental illness, or someone living with a substance use disorder. And some key takeaways from that survey: the top anticipated messaging barrier included the lack of understanding about, one, what will happen when someone calls 988, two, the difference when to call 988 versus when to call 911, and three, that 988 is part of a broader crisis system infrastructure that needs to be in place. Other key takeaways: survey respondents identified an immediate need for information and guidance from national leaders around messaging about 988. In addition, respondents highlighted the need for messages to be culturally competent and built on trust, and to recognize the nuance and complexities around how crisis care continuum will work in each state. Next. Finally, in August of 2021, the Action Alliance brought together diverse public and private sectors to serve on our 988 messaging task force, which was co-led by SAMHSA and Vibrant, again, who we have on today's webinar. The task force was charged with developing the 988 messaging framework. They met bi-monthly over the past 8 months. And in addition to the task force members, we also partnered with key organizations who served as reviewers for the 988 messaging framework, helping to really provide some additional perspectives to ensure the framework really meets the needs of the field. Next. And here on this slide is just a snapshot of some of the organizations and agencies represented as part of the 988 messaging framework. And again, some of you are on today's call. We do thank you for your time and leadership and commitment over the past 8+ months to this work. Next. So just a little bit of background about the framework, how it was informed. Now I want to turn it over to my colleague, Mark Custer, Director of Rheingold, who will now walk us through the framework itself and how you all can use it to inform your messaging efforts. Mark.
Thank you, Kim. And thank you to everyone who made the time to be with us today. I'm always impressed by the passion and the commitment of this field, and today is certainly no exception. So as Kim mentioned, I'm here to walk through the framework and its components to give you a sense of what it is and how it might help you as you communicate with the world about 988. So without further ado, first up, we're starting with an easy one. Who is the framework for and what is its purpose? So the framework is essentially designed with you all in mind. It's intended for anyone publicly messaging about 988, whether that be state agencies, crisis centers, nonprofit organizations, businesses, or really any other group with an interest about communicating effectively and safely about 988. The purpose of the framework is to provide general guidance about when and how to message about 988 to ensure that your communications are effective, coordinated, and safe. So while there are some key messages and talking points included in the framework, we didn't really set out to develop tailored messages that spoke to every audience. We know there's no one-size-fits-all message that's going to resonate universally. And at the end of the day, you all know your audience is better than anyone, and will be the most effective at tailoring content to meet those needs. So with that, we can get into the next slide, a bit about the 988 framework elements. So 2 main sections therein: timing and messaging considerations. So we want to make sure that we're providing guidance as we get closer and closer to July, when that transition will occur. But there's a lot that you can do before transition. There might not be all the same communications and talking points that you'll have once the service is up and running, but there's a lot of preparatory work, planning, research that can be done in addition to what you're going to obviously be doing after the transition. In addition to messaging considerations, there's several key factors that we want you to be mindful of for best practices, amplifying your message, tailoring to your audiences. So we'll provide those as well, along with some concrete recommendations and resources to help you in every step of the way. So first, we'll move into the timing section, specifically when to message. So the key factor in this, and if you go to the next slide, obviously is the transition date. So there'll be some significant differences beforehand. Before July, one of the biggest factors is to hold off on actively promoting use of 988, sticking with the current 1-800 number instead to ensure that people aren't mistakenly using 988 before it's operational. Instead, what we really want to encourage is for you to share basic information about 988 with your implementation partners rather than the broader public. So who's it for? What is it? Who does it serve? How does it work? Foundational information like that will help set the stage for when it is time to really promote use of it. But this isn't to say that you should just be sitting on your hands or that you can't be doing anything. It's a perfect time to develop a strategy for your communications efforts, reaching out to individuals from diverse backgrounds and varied perspectives and lived experiences to do that foundational research to inform a robust and equitable messaging plan. After July, of course, that opens up the aperture a bit into how we can broaden messaging and expand that to target other key audiences and to begin promoting the use of 988. As with any communications campaign, it's helpful to be on the lookout for some research that'll be coming, helping to develop a guided national campaign communicating effectively about 988. So in addition to doing your own research, there'll be more to come, and it's helpful to look to other advocacy groups, to other states, other groups who are operating in this space who might be doing research and developing campaigns that could be used to inform your own. And finally, there's also going to be a need to promote additional supports to help generate continued support to strengthen crisis infrastructure. At the end of the day, this is an important first step, but it's just that, first step, not job done. So with that, to the next slide, we'll get into understanding how 988 works, the first of our key messaging considerations. So in addition to guidance on timing, we've also got some of these recommendations to help you craft the information and the communications that you're going to be developing. The first factor here is to work with local implementers, as there will be some consistency between states, of course, with 988 rolling out, but there will also be some specific differences from community to community, and understanding what the 988 infrastructure looks like in your community, including answers to questions about whether mobile crisis teams will be available and similar points of difference will be invaluable to helping you communicate effectively. Familiarize yourself with who operates the line, how calls, chats, and texts are handled. Being able to set those accurate expectations about using 988 can really help lower some barriers to entry for individuals who may be reluctant to use 988 otherwise. Finally, understand that accessibility and inclusions are really key factors for 988. It's available via call, chat, and text to make sure it meets the needs of different individuals with different communications modes. And it's also going to offer interpretation services in more than 150 languages to those who don't speak in English. On the next slide, knowing what 988 is and also what it isn't. So to ensure that you're messaging accurate information, again, it's really important to know where 988 sits in the crisis infrastructure and ecosystem. There's other groups such as 911, 211, warm lines, and other crisis centers who operate in this space. And understanding where 988 fits in alongside those is really an essential point to be able to communicate to your audiences. We want to emphasize that 988 and 911 are designed to complement one another to address the needs of individuals in crisis. But what really will set 988 apart from other three-digit crisis lines is that 988 is going to be staffed with trained counselors with experience in de-escalating a crisis. So there's some points of context and nuance there that are really helpful. You also want to reinforce that 988 is more than just a three-digit number. Again, we keep driving it home. This is the first step of something big. It's not the end of this journey to strengthen crisis services. It's just that first step. It's an opportunity for partners to reimagine their crisis service infrastructure and securing key services such as crisis call centers, mobile crisis services, and crisis stabilization services. Next. Following up, luckily, this alludes a little bit to what John was saying earlier, that we're lucky to be able to build from some of the foundational elements that already exist. One such being the framework for successful messaging. It's already got a lot of great best practices for messaging guidance about suicide and suicide prevention. There's a lot of information there about being strategic with your communications, how to be safe with your messaging, following a positive narrative to reinforce solutions, and using data strategically. These are all key components to effectively communicating with your audience and helping to spread the word about these services and what they're providing to the world. So it's key to keep those in mind, and we'd encourage everyone to look back on those resources and reference them as you're building out your own messaging. That, moving on to the next slide, tailoring 988 messaging for your audience. Like I said earlier, we're aware there's no size-fits-all message that's going to resonate with every audience. There's always going to be a need to tailor your content to speak to groups and individuals with different backgrounds, perspectives, and experiences. So with that in mind, consider who makes up your key audiences before you begin to develop messages to make sure your communications address their needs. think through using information from resources such as the CDC's Health Equity Guiding Principles for Inclusive Communication. Resources such as that are going to help you factor through things that might be in your blind spot and things that you hadn't considered without looking into them. So be sure to keep an eye out for those. Finally, don't operate in a vacuum. Collaborate with organizations that have extensive expertise working on the ground with various populations, such as tribal communities, Black or Latino communities, youth, LGBTQ populations. This is going to help strengthen your understanding of those audiences and what their needs are, and make you more effective at communicating with them at the end of the day. And then moving on, last but not least, amplifying your message. So you've done the research, made a strategy, developed your messages, and it's finally time to share it with the world. We're not going to just go with the if you build it, they will come approach. Worked for Kevin Costner. We're not going to bank on it here. So with that, we're going to start with partnering with local or national champions to help get the word out to your audiences. Think through those groups that are going to have an authoritative voice and standing in your community, whether that's local government, media, faith leaders. These champions oftentimes serve as very trusted resource who can sort of penetrate into an audience that might be reluctant to accept it from someone they're not as familiar with. So make those relationships, spread the word, work together to help spread the word. Engaging storytellers with diverse perspectives and lived experiences, another key factor. People who have been through it and understand what this world looks like can speak to the value of support and help promote resources, and do it with that really authoritative and compelling way. In addition to those champions, we also want to encourage you to connect with news media and encourage their use of best reporting practices. So that obviously refers back to the framework for successful messaging. But there's other resources. We've actually got a 988 messaging framework media toolkit right on the page. There's also information like the recommendations for reporting on suicide. The better that the media are at communicating this, it will improve their capacity to shape perceptions, increase awareness and understanding of 988. So with that, I will turn it back to Kim, and thank you all for your time.
Great. Thanks so much, Mark. And I would now like to turn it to Kate Galatas, who serves as the public sector co-lead for the 988 Messaging Task Force and also serves as the Chief 988 Communications and Engagement Officer with SAMHSA. And she'll lead us into a discussion to provide an overview of the 988 messaging resources that have been developed for the field and SAMHSA's plans to continue developing additional resources moving forward. Kate?
Thank you, Kimberly, and thanks to everyone, especially my task force co-lead, Vibrant and Action Alliance, but also to all the task force members. It was a lot of work in getting here today, and it's a beautiful product for all of the collaborative efforts. So thank you. Next. Won't spend much time here because we've really heard about the short and long-term vision for what 988 is and what July 16th of 2022 represents, which is really that transformative moment where we begin to reimagine the crisis care system available to us in the US. So it is, again, a product and a vision and a process that is better when we do this all together like we are today. Next. So from the outset, I would say that SAMHSA's communication strategy for 988 has really been to work with and through our partners. So how we got to the framework is a perfect example of that. But I think overall, the important thing to remember about SAMHSA's approach to communication is really, it's kind of just a testament to the power of crowdsourcing. So we are constantly wanting to hear from our partners, work with our partners to develop materials, strategies, messages that they need and that they want and that they would use, so that we can truly drive at a national level a common narrative about 988 and what's available and what is coming. So I want to, make sure that you all know that that's kind of the heart of our approach. And we've already talked about the framework. Y'all saw some of the framework. I really encourage you to go visit the website and drill into the tool itself. But what I'm really going to focus the rest of today on is the complementary communication pieces and tools and products that SAMHSA is offering to the partner community to kind of go hand in hand with the messaging framework. So the framework is really the how you approach communication. And then we want to help with and here's some of the things to communicate or use as you communicate. So next slide. So our first step was last week, actually, we went live with what is our new 988 web page within SAMHSA's site. And so this is really what we would hope that all of you consider to be your one-stop shop for 988 resources. You'll see the website here, the link here, and then a little screenshot of the site, which I know you can't see entirely, but just to briefly talk about what's here, you'll find some general information about 988. You will, of course, find the partner toolkit, which we're going to go into in just a minute. But you also can find links here to data from both SAMHSA and CDC. You can walk through an interactive timeline of the history of the Lifeline and more. There's a press room availability there where our newsroom is, and just a lot of resources. So we want to make sure that folks know this is there and that you bookmark it when you go visit it after this presentation, and you come back for more. Next. So just to drill into the partner toolkit a little bit. So there are several assets that are kind of there now and available to all of you. And we hope that you kind of use them. So you'll see there's just general overview fact sheet about 988. That's both in English and Spanish, and that you can download from the site. But most importantly, there are key messages available. And these, again, a testament to crowdsourcing. These were extensively kind of vetted through a lot of our partners. Many of you on this webinar today gave us input and perspectives on these key messages. And these are really intended to be broad, high-level messages that everyone can use about 988. Again, will help drive that common narrative so that people start hearing consistently some of the same things about 988 and what it is, what's available, how to access it. And so those are really important. Now, it's been mentioned a couple of times, but it's worth mentioning again. These are not audience specific, tailored messages. We know that you all, again, know your audiences best. So we're going to rely on you to build from the key messages, but all of us should be kind of hitting a certain level of that similar framing at the highest level. There are also a pretty robust set of FAQs available on the within the partner toolkit right now. We have heard again through our crowdsourcing efforts what some of those common questions are. So we have started to try and make sure we address those with some short and clear answers. And both from the key messages and the FAQs, we will continue to add to those. But there is also more to come in terms of tools and resources. So if we go to the next slide, I'll spend a little bit of time here talking about, again, as we hear from partners about what their needs are, where we are understanding that, many of you are wanting, things like brief animated videos. These are like, 5-second videos that we may be able to use come July to really push out in social and use in digital formats. So looking at doing those, look at doing some social, some sample social media posts that you all can use. We'll have graphics embedded with those. We will be doing short infographics, wallet cards, e-newsletters, maybe even some radio PSA scripts. So over time, we will continue to grow the assets and the resources available to you all within the partner toolkit. We can't do all of it immediately, so we will add to this over time as we can, but we understand that in order for you all to do your communication planning, you need some resources, and B, you need to know when different things will be coming. So we hope to have an update to our toolkit as early as April 15th, where we'll make a lot more resources available again to aid in all of the partners and y'all's efforts really to do your planning in advance of July 16th. So next. So when the rubber meets the road, what can you do? And there's a lot that all of you are doing already, and there's a lot that we would love for you to do with these specific tools. So again, use the message framework, use the 988 key messages and FAQs and other resources that we'll add to the SAMHSA 988 Partner Toolkit. Visit our page, bookmark it, share the web link with your partners and others, download our fact sheets, share those, but really most importantly, come back and for more, really think of that 988 website as your one-stop shop and let us know what you're finding useful there and what you want to see more of. So that's it. Thank you, everybody.
Great. Thank you for the update and thorough overview, Kate. It's really a great reminder that while the 988 messaging framework is officially released, other messaging resources and efforts are underway and will continue to be well after the rollout. In addition, it's important to note that as of more information and resources are available, we will continue to update the 988 messaging research framework to make sure that it really reflects the latest information that's out there. Now I'd like to spend the remainder of our time answering your questions and hearing from you. Well, many of you sent questions ahead of our webinar. We'd also encourage you to use the QA feature to pose additional any comments, information, or questions. And again, due to time, we might not get to all of them, but we're going to do our best to answer as many as possible. We are also documenting these, and we'll be sure to share as much information after the webinar as possible. So I will ask our panelists to go back on video and be part of today's Q&A as you each bring some very unique perspectives to this work. I will say to the panelists, we have received many very good questions, and I thank all of you for chiming into today's discussion. So I want to go into one question that we've heard from many of you before today's webinar, and then I'm also seeing it in the chat here. And that question really focuses on high-risk populations. So the question really is, how is the field developing messaging for high-risk and marginalized communities, such as LGBTQ youth, communities of color, etc.? We know, I think this is definitely a need that we're hearing. This is something that we heard when we put out the 988 messaging survey this past summer. We heard it from our task force members and others that we're talking to, that this is a need. And that's one of the reasons why we made sure the task force really included diverse representation from key groups that are working with marginalized communities. And as Mark mentioned earlier, a key part of the messaging framework really explores how to message to specific communities, especially those that are higher risk. And also, there's some things underway by states, such as we know Utah and Nebraska, that are already kind of doing some focus groups to better understand how to message to different communities, especially, again, those that are at higher risk. But we also know we can't stop there. We know that there needs to be work done at the community and local and state level, but also at the national level. And we know that there's been active discussion there. So I will stop and turn it over to some of our panelists to see if they have any other information to share. So maybe Kate or John, anything or any input you'd like to add?
Sure, I'll say that, at SAMHSA, we really are hoping to do a couple of things. So in the government, it is always determined by what you're funded to do and when you're able to do that, right? So big caveat, but I will say that there is both interest, intent, and commitment from the SAMHSA side to really look at how do we better understand the knowledge, attitudes, and beliefs of some of the populations at higher risk. So like what you've talked about, Kimberly. And we need to really have research be the foundational piece to any strategy we do moving forward in this communication arena. So really understanding not just the knowledge, attitudes, and beliefs, but perceptions around risk of suicide. What does our terminology mean to people in some of these populations, and then really what are some motivating factors, or conversely, what might be some barriers to the help-seeking behaviors that we would want, especially around using a resource like 988. So these are all fundamental research kind of questions that we need to really grapple with as we think about hopefully what is a longer-term vision for more than an awareness campaign, a behavior change campaign, a campaign where we can really use engagement, not just it's never really about just the right message. It's about the whole package of approach and fundamental engagement that you do with these populations at high risk, and how we can get them to trust and use a service like 988. So that's the longer term vision of where we at SAMHSA would love to go. In the interim, we will continue, of course, to work in our very crowdsourcing way to make sure that we have tools and messages and some of the basics covered so that we can be actively communicating about 988 together come July 16th. But in the future, we very much would want to grow a more national effort.
Great. Thank you, Kate. Anyone else in the panel have anything to add before we move on to our next question?
I mean, I would just add on just briefly to what Kate said, and completely would echo her statement about the commitment on the part of SAMHSA to really dig into this work more extensively, recognizing that it's critical for lives to be saved, and that there obviously are populations both at higher risk of suicide, certainly who have inequities with respect to access and impact of gaps in the service system. And there are things that we can build upon. There has been some foundational work looking at some of these populations and what some of their needs and preferences are and how they're influenced with respect to help-seeking behavior. And we really need to build upon that to really craft a more specific, tailored messaging and strategies to engage them. So definitely more to come. And at the same time, looking at what has been done, there are other threads of activity through some of the work that we're doing with states, as I think you mentioned earlier, in terms of building out some additional expertise around working with populations at higher risk. So we will continue to move things forward and put all the pieces together as our resourcing allows.
Thank you, John. All right, our next question is really around technical assistance and wondering if it's going to be available to states around messaging about 988. Another very good question. We know all of you on today's call are busy juggling other things. And so the easier we can make it, providing resources and guidance, the easier it's going to be for all of you. So great question. And thank you for asking that. I know we have, I believe, Joey from Vibrant on the call. And I know Vibrant Emotional Health is doing some great things regarding communication planning as part of their grantee work. So Joey, wondering if I can maybe punt it to you to talk a little bit about that. And as we wait for Joey to join, if anyone of the other panelists have anything to add, please do so.
Yeah, I mean, I'm happy while we're waiting, Kim, if that's okay.
Sure.
I can also respond to that if you'd like.
Oh, go ahead, John.
Sure, no problem. Well, in addition to the planning grants that Vibrant provided the states and territories in January of 2021, our communications team has been providing technical assistance to our state grantees to help them prepare for July. So we expect to continue to hold additional meetings leading up to the launch as well as after the launch to support our grantees. You also heard from Kate earlier that the messaging toolkit will continue to be updated over time. So we're going to be using that toolkit along with the messaging framework presented today to help us move towards growing technical assistance. And again, this is an evolving process. And John, you mentioned some of the acculturated needs over time. So this is a toolkit that's going to have a lot more tools over time. And we're happy to provide technical assistance towards that goal.
Thanks, John. I couldn't get off of mute. So John answered it perfectly.
Thanks, Joey, and thanks, John. I know we're getting close on time, and again, if I could show everyone how many wonderful questions we're getting in, and we are documenting these, so please know your questions are not going to go on deaf ears. We're going to ensure that we're following up. But another question we have is, what's the difference between education and promotion when it comes to messaging about 988? And another question we just got in our YouTube channel is very similar, is should we be promoting and advertising 988, or should we be holding off until July 2023? So if we could touch upon, maybe Kate or Mark Custer, you might have some good things to add there, of difference between education and promotion, and if people should be holding off on promoting and advertising until July 16th, 2022, I should say.
So I'll take a first shot at that. I will say that as John Palmieri noted earlier, with July 16th as the transition date, that's the date by which all carriers, mobile and telecommunication carriers, have to make access to 988 available to their, customers. So that is the date by which we know everyone will have access to the existing Lifeline via 988. So that's why we're asking folks to hold on actively promoting like direct to consumer marketing and all. Certainly don't do anything before then, because you could have the inadvertent problem of messaging that to someone who does not yet have access via that way. The other important thing I want folks to know is even after July 16th, as we've talked about this ramp up to 988, I want to make sure that folks on this webinar understand that you can access the Lifeline even after July 16th, either via 988 or the existing 10-digit code. So the 10-digit code doesn't ever go away. So that is a common question we've gotten a lot, and I just want to make sure that I say that as well. And I want to also say that in terms of post, kind of like what Mark said during the framework overview, post July 16th, it really is, if you're thinking about active, like paid advertising, for example, to really, or digital buys or something like that, those are the things we're asking for folks to do in collaboration with their local implementers of 988 to make sure that that the additional driving additional traffic is going to be, it's the right time for that. So that's that piece. as well. So again, not before July 16th, very purposefully after July 16th, and understand that we, SAMHSA, are putting these materials out there, not because we want people to start using them right now today, but you have to know what's available to you to start planning your efforts. And you also have to know some of these key messages as you do your local engagement and your local partner and involving other people in the implementing of 988. You need some of this information to be able to do that as well.
Yeah, and just to add to that a little bit, there's probably a focus shift both in terms of the content that you're sharing between education and promotion and the folks that you're sharing it to. On the education front, that's really the baseline stuff. What is it? Who's it for? How do they access it? Some of those questions about the 1-800 number, really that foundational stuff that really needs to get out there so people understand what the service is, what's new, what's not, and how to use it. But that step short of actively saying, now go, dial it up, text it, chat it. That's really what we want to hold off on until the promotional element is ready. Just like Kate said, you really just want to make sure that no one's inadvertently getting routed to something that they're not going to have access to or that they have trouble connecting with, especially given sort of the critical nature of the service. There is that higher threshold to clear of being safe about that. So just a little bit of additional commentary there. Thank you.
Great. Thank you, Kate, and thank you, Mark. I know we're coming up on time, but I just want to go quickly over some of the questions. I know we can't answer them today, but just some really good questions coming in here. We have for national organizations with a national audience, how do you suggest we communicate about 988 given the varying levels of readiness at the local level? We saw that 3 or 4 times, similar question there. Will there be a national campaign or will all campaigns be at the state level? Will there be brand guidelines for 988? Will we have 988 messaging guidance for how to handle post-crisis follow-up? Can in our messaging, we further define what we mean by crisis? Another great question. We've also gotten a lot of questions about equity and ensure that that's really key as we're thinking about our messaging. So just, again, really good comments. We're noting all these. We'll be sure to take a close look to provide further clarification and information as much as possible. But one really quick that we are getting over and over again is, what do we call it? And that's a great question. And Kate, I believe the answer to that is we are calling it the Suicide Prevention and Crisis Lifeline. Is that correct?
So it's the 988 Suicide and Crisis Lifeline.
Great, thank you. We'll be sure to include that also in the follow-up. So next slide, just want to do a few closing remarks here. Thank you to our speakers, John, Mark, and Kate. We so appreciate all of your great points and time today. We know that 988 transition is a huge undertaking, not only for those on the ground and doing this work to get states and agencies ready, but there's also national level efforts needed to really ensure, again, ongoing coordination and alignment. And I would really like to thank the 988 Messaging Task Force and the reviewers for providing guidance to the 988 messaging framework. I also want to thank each of you who completed the 988 messaging survey in the summer of 2021. That information was extremely helpful and really used to inform the 988 messaging framework. And finally, I would like to thank Action Alliance Executive Committee partner, Johnson & Johnson, for their support in developing the 988 framework. Next. So as we highlighted, we all have a role to play. I think that was one key takeaway we heard during today's webinar. And we hope that each of you will use the 988 messaging framework and its related resources as you continue to think through and develop messaging about this important transition. And as Mark mentioned earlier, we developed a promotional toolkit to help you and your organization further promote awareness of the framework. Again, we'll include that in the post-meeting notes. And we'll continue, as we mentioned, to update the messaging framework with the latest messaging guidance and resources from both SAMHSA and Vibrant and others. So please visit now the 988 messaging framework, which you can access at 988messaging.org. And finally, the big thanks goes to each and every one of you for dialing in and participating on today's webinar and asking such great questions. Again, we will be sure that we are following up with you. As I've mentioned when we started this call, we cannot do this alone. It takes each and every one of us together to be working in collaboration around this very exciting and monumental opportunity. Thank you for all you do, and we will be following up after with the slides. We know that was another question that we heard. A recording of the webinar, especially for those who were not able to be part of it, and other information, including some of the answers to your great questions. So thank you, and I hope you have a wonderful rest of your day.